I'm Casey Arriaga, and I am a clinician here at Windmill Wellness Ranch, which is the Drug and Alcohol Treatment Center. So the major ways that addiction can run in families and get passed down would be, first and foremost, genetics. That's maybe the most obvious. And there are certain genes that predispose somebody to addiction. And if those all come together in the same person, they're much more vulnerable. But like anything genetic, like maybe say red hair or blue eyes in a family, you might find there's a whole generation where everybody has it, and then it skips a couple generations, then it comes up again, and then like one of the grandkids gets it, that sort of thing. Well, some of the genetics around addiction can work the same way. So we'll often see it in family trees where it shows up. Someone will say, all the men in my family are alcoholics. Someone else will say, it's all the women who over time. For instance, in my wife's family, a lot of the women became addicted to alcohol in their 60s due to a certain type of arthritis that they would all get. Alcohol helped to solve the pain. They started combining alcohol with painkillers, and a bunch of them all died of addiction, even though they'd gotten away scot-free, so to speak, for most of their lives. Another big way it can be passed down, though, is through family culture, and this is often unintentional, but there are certain patterns that may have been established generations ago that nobody really realized were tied to addiction that then get passed down as part of the family culture. Things like we don't talk about our feelings, or we don't air our dirty laundry in the street. Well, a simple thing like that might say, oh, I'm protecting my family, can have a profound influence on somebody's ability to reach out for help, to recognize that they're struggling emotionally, things like that. So those cultural things can also get passed down through families unintentionally that make somebody more vulnerable to addiction. If the family keeps repeating certain circumstances or traumatic things that get passed down from generation to generation, in certain families, a lot more people are affected by addiction. Well, the most obvious way to recognize if this is true in your family would be to notice, boy, there's a lot of addiction in the family. And sometimes we miss that because not everyone in the family gets addicted to the same things. So if we recognize that addiction, for instance, can be bigger than just even chemical use, or bigger than just alcohol, or bigger than just heroin, because sometimes we'll say, oh, well, my cousin Johnny, he's a real addict because he was doing methamphetamine. When you notice everyone else in the family is drinking, and that drinking is really influencing what happens within the family, it's affecting people's emotional expression, things like that. If we don't recognize that, we might think there's one person with addiction in the family. If we can recognize the broader pattern, then we might notice there's a lot of people with addiction in the family. If we look beyond just chemical use, we might also notice gambling addiction, codependency, sex and love addiction, things like that. I was working with a family one time, and we were doing a family tree exercise up on a board, and the father of our client said, well, I don't know if my dad was a sex addict, but he did have 30 affairs on my mom. We said, well, there's a form of addiction that maybe no one had considered. And it was eye-opening for our client, because the client who was watching this family tree get put together by family members in a family session suddenly realized he wasn't the one person in the family with a problem. We can also recognize if the family has trouble talking about it. That's often a sign, ironically, that it does run in families, because families often learned generations ago not to talk about it, to keep it quiet so it didn't hurt the family, didn't hurt employment chances, didn't make them look bad in front of the neighbors. And so noticing that people have trouble talking about addiction, have trouble talking about feelings, have trouble reaching out for help or dealing with emotional issues can also be a sign that that's happening within families. If somebody seems to be the only one in their family with addiction, what I'd often say is, first of all, maybe the family's not talking about it, or there are things that aren't just being expressed. And sometimes if they start digging into the family tree and the roots, they can start to find out that there's actually a lot more of it going on. But sometimes it may have just skipped several generations. And so they may recognize that maybe there was a great-grandparent or somebody who may have struggled with or even died from addiction, that it didn't get attributed to that. Maybe they died in a car accident and everyone thought that was the real cause. But we can recognize that, in fact, it just skipped several generations, showed up. So I would reassure most people that if they're struggling with addiction, they're probably not the only person in the family who's ever struggled with it, but maybe the family just doesn't have the tools in that moment to recognize what's happening and deal with it right then. But luckily, those tools are available. So if somebody knows that addiction runs in their family, there are certain things that we can do to protect the individual, and I'm going to say just as importantly, to protect future generations. So if heart disease ran in your family, you'd probably tell your kids, heart disease runs in our family, here's certain things that you can do to protect yourself from it. At least I hope you would. But with addiction, often because there's embarrassment and shame and stigma around it, people learn not to talk about it. I'm going to say we want to break through that shame, break through that stigma, and start being able to tell kids in really phrasing and words that they can understand. Around 8 or 10 years old, people start to hit puberty. And at that point, our brain starts to shift in the way we think about risk and how much risk we're willing to take. And also we become more open to the idea of drug use. So you give a little kid a sip of wine or beer at 5 years old and, ooh, that's gross. Why would I do that? How can you drink that stuff? Same thing at 10 or 12 years old, and it might suddenly feel very appealing. So we want to get in early and tell kids, this is what's going on in the family. Here's some things you can do to protect yourself. So that's the next question. How do you protect yourself? How do you protect the kids? So some of the big factors that we've seen are emotional openness. Teaching our kids it's okay to talk about problems, it's okay to ask for help. We also find that having a spiritual connection, which doesn't have to be religious, but just a sense of connection to the greater world, a sense of service, giving back, that these are important values within the family, actually can be a protective factor. We can also, just in a straightforward way, warn them certain chemicals or activities seem to become addictions within our family, so you want to be really cautious about those. And then one really big thing as parents would be to model those behaviors. So modeling not just not drinking or not doing other drugs, but modeling emotional openness, modeling spiritual connection, modeling a spirit of service. All of those things can be helpful to future generations. So family recovery is a concept that is really important, and that's the idea that if one person has addiction, they're going to affect all the people around them. We kind of know that already, but what often happens is we think if we solve that one person's problem, if we get them on track, everyone else will naturally be okay. This does not turn out to be true. I do a lot of family work with a lot of families for years and years around addiction, and I have yet to see a family where that turned out to be true. It turns out that everybody around the person with addiction also needed to recover from that experience. But also, if addiction does tend to run in the family, you may have been affected by past generations, their behavior, their attitudes, the things they've passed down. We may need to recover from those even if we haven't been as directly affected by addiction. So family recovery becomes this idea, not that everyone has to recover together, because some people may not be excited about it, some people may get really caught up in it, but what we'll see happen is that the people who are affected by addiction, who decide to get recovery, can have a positive effect on everyone around them. So for instance, we already know if one person has addiction, they can affect everybody else. Well, if that same person gets recovery, that can positively affect everyone else. That isn't necessarily the person with the addiction who gets recovery first. Sometimes a family member does. One of those people being affected might find that they get into one of the recovery fellowships like Al-Anon or Smart Recovery Family and Friends, or they get involved in a drug and alcohol family recovery program. There are some that are privately run or run by a therapist. They might go see a therapist who specializes in addiction and family issues. All of those things can be helpful, and if that person starts to get help, it can have a really beneficial effect on everyone else, even if the person with the addiction doesn't get recovery yet. So family recovery is also really important if the person with the addiction starts to get into recovery. Sometimes the people around them aren't sure what to do. So here's a few just basic ideas that you can look at. One would be, like we said earlier, to normalize being able to talk about the addiction, to be able to talk openly about the emotional issues, to be able to say, here's how I felt affected. Rather than walking on eggshells or trying to baby that person or say the person in recovery, we have to wrap them in bubble wrap, then maybe a little steel, and we'll pour some concrete around that. We're going to protect them from any kind of upset or emotional distress. The opposite is true. They actually have to learn how to deal with those things. So within the family, learning how to talk openly about everybody's emotional issues, about everybody's struggles, and also for the family to try not to talk down. It can be easy to say, I'm up here, my life's kind of looking okay. You're down here, your life looks like it's falling apart, so from on high, I'm going to talk down to you. But most people don't like to be talked down to. So instead of that, we're going to learn how to bring it human-to-human communication for the family members to get used to being able to say where they struggle, that they're not doing okay when they're not, and the person with the addiction can also learn how to talk about when they're struggling, when they're not doing okay. But it's also important for everyone to be able to get some support outside of just the family. The person with the addiction needs to learn how to talk to other people who are in recovery from addiction, and family members need to learn how to talk to other people who are in recovery in the family way or in family recovery. So one of the things that I love about doing family work at Windmill, and I'm privileged to be able to run our family program, is that we have the opportunity to work with all of the families, and because we also do a video online component with that, we can have family members come in from anywhere in the country because we have clients come from all over the place. So even if as a family member you're not able to make it down to the treatment center, we can still get you involved, and we're very eager to have you involved. Now, we also have something that I haven't seen anywhere else, which is that we involve alumni families and alumni clients in our family workshop. So if you're a family member coming in, whether your loved one's been to treatment 10 times or never before, you can still benefit from the experience, strength, and hope of other people who have been directly through Windmill, whether they've come through as clients and talk about what were their struggles, what were their successes, what helped them. You can also hear from family members with a depth of experience who can say, here's what I did when my loved one called home from Windmill and said this thing, or here's what I've done 6 months after they got out, and get to hear a lot of that experience, strength, and hope. And so we do that every weekend. We have this wonderful conversation that shows up in our family workshop, where we get to hear people who are brand new to family recovery. We get to hear people with experience from addiction recovery, and we get to hear people with a lot of experience around family recovery. And it's just a blessing to be able to do that.